It's just a moment. Ito nang inaantay natin guys na ma-live ang bicameral meeting. Hindi lang hindi lang sila ang mag-uusap, kasama na tayo. Ayan. Okay, hintay-hintay lang. Sila ay may ginagawa pa. Exciting ito guys.
Let's resume the bicam.
Thank you, Senwin. To give time to the technical staff to work out the figures for Philippine Science High School, may we move to a different agency?
Yes, we'll do that since we are going to include that already in our discussion, so it's better to have those details. So we'll move to another agency, which is the health sector. We'll start off with the Department of Health.
On the part of the House, under the Department of Health, we would like to propose an increase of 2.4 million pesos for HFEP, billion pesos. I'll disaggregate this po. But the total for HFEP rather is an increase of 5.79 billion pesos. 2.4 billion pesos of that would go towards the completion of legacy hospitals such as NKTI, Philippine Cancer Center, Philippine Children's Medical Center, Mariano Marcos Memorial Hospital and Medical Center, West Visayas State University Medical Center, and other hospitals. On top of that, there would be 3.39 billion pesos allocated towards the other health facilities. There is also an additional proposed increase of 150 million pesos towards the Philippine Children's Medical Center for different items such as MOE allocation, provision of essential cancer medicines, diagnostics, strengthening of multidisciplinary care teams, and expansion of the patient support program. And finally, we propose an increase of 24.8 billion pesos for the medical assistance to indigent and financially incapacitated patients or MAIFIP program. The increase in MAIFIP is due to the need to fund the government's, the directive of President Ferdinand Marcos Jr. to enable zero balance billing for indigent patients in all government hospitals throughout the country. So those are the proposals, Senwin, of the House. The additional 5.79 billion pesos for HFAP, the additional 150 million pesos for the Philippine Children's Medical Center, and the additional 24.8 billion pesos for MAIFIP.
Thank you, Congresswoman Mika. I'll start off with the Office of the Secretary first. For the Senate, we propose for the Office of the Secretary 269 billion pesos. 297 billion pesos. Kunin ko nga ruler. Sorry sir, wala kasing ruler. For the Office of the Secretary, 297 billion pesos. For operations of DOH hospitals in Metro Manila, mainly MOOE, for the implementation DOH regional hospitals and other health facilities, mainly MOE for implementation ZBB in DOH hospitals in the region, 101.7 billion pesos. Ano itong 1 billion?
Ganun din operations of
LGU, no? Sorry, hindi ho kasi naka-expand dito. Operations of LGU hospitals and other health facilities, mainly MOE, for the implementation of ZBB in LGU hospitals in the region, 1 billion pesos. Cancer Assistance Fund, 1.5 billion pesos. Health sector research development, 92 million pesos. 92. Yeah. Sorry, 92. Health sector research development, 92 million. Health emergency preparedness and response, 8 to 9 million. Health facilities enhancement program, 16 billion.
26 ma'am. Ay, sir. 26 billion.
MAIF-PIP
Okay.
is 28 billion.
Kasi
Yeah.
yung kanila ma'am.
Any comments, motions?
Madam Chair?
MAIFIP. Yeah. Senwin, and to the members of the Senate contingent to the BICAM, if we may appeal for the adoption of the additional 24.96 billion pesos for the MAIFIP program, thereby increasing the amount to 49.2 billion pesos. That would be a huge help or actually that would be the enabling factor to implement the zero balance billing in all government hospitals all throughout the country. So without this, we believe without this amount, without the additional 2.97 billion towards MAIFIP, we will not be able to operationalize the directive of President Ferdinand Marcos Jr. to implement zero balance billing in all government hospitals all throughout the country. So that is the most important point on the part of the House contingent.
One minute suspension, Mr. President.
Suspended na naman. Suspended na naman, guys. Wait lang muna tayo, ha? Something. Ano ba yan? Live nga, pero ang ano naman, ang dalas naman ng ano ba yun? Yung suspended. Sige guys, maghintay lang tayo. Sorry ha. May suspended pa sila pero kailangan nating manood kasi talagang exciting ito. Final na to guys.
Right, let's resume.
Thank you. May I now recognize Deputy Speaker Christine Singson Mihan.
Yes, just a manifestation from the House regarding our request to retain the amount for the MAIPIF on the age gap. So number one reason, it ensures immediate access to life-saving healthcare. MAI provides direct financial support for hospitalization, diagnostic surgeries, medicines, and emergency care para po sa indigent and vulnerable patients. Increasing or retaining funds ensures that life-threatening cases are not delayed due to inability to pay. Number 2, it protects low-income families from catastrophic health expenses. Many Filipino families fall into debt or poverty because of sudden medical bills. MAIP absorbs a significant portion of these costs, preventing financial collapse and preserving household stability. Addresses high demand for public hospital services. Public hospitals continue to experience rising patient volumes due to economic pressures and limited access to private care. Adequate MAIP funding ensures hospitals can respond to this growing demand without compromising service delivery. Number 4, strengthens universal healthcare implementation. MAIP fills critical gaps where insurance coverage, example, PhilHealth, is insufficient or unavailable. Maintaining strong MAIP funding supports UHC by ensuring no patient is denied care due to cost. 5, reduces administrative burden on hospitals. With sufficient MAIP resources, hospitals can streamline patient processing, minimize unpaid bills, and improve overall operations. Minsan kasi yung hospital ginagamit na yung sarili nilang funds kung kulang yung MAIP funding nila. This allows facilities to allocate resources to service improvements rather than debt management. Number 6, supports the most vulnerable sectors. Beneficiaries often include senior citizens, PWDs, solo parents, minimum wage earners, and unemployed patients. Sustaining MAIP ensures these groups have reliable, equitable access to essential medical treatment. Number 7, strengthens public health emergency response. MAIP funding becomes especially critical during disease outbreaks, disasters, and public health crises. Increased funding allows DH facilities to respond quickly without resource constraints. Number 8, promotes healthy equity across regions. Many isolated and disadvantaged areas rely heavily on government-funded medical assistance. Retained or increased MAIP funding prevents further widening of health disparities between rural and urban populations. Number 9, prevents service interruptions in DOH hospitals. Inadequate MAIP budgets could lead to delayed treatments, supply shortages, or limitations on who can receive assistance. Stable funding ensures continuous uninterrupted patient care. And number 10, delivers high social and economic return on investment. Healthy individuals are more productive, less dependent on long-term government aid, and able to contribute to the economy. Investing in medical assistance yields long-term benefits that far outweigh the program's cost. And I think some of my colleagues wants to share some experiences with their MAIP funding of their district, their constituents.
Representative Pepito Alvarez.
Yeah, Mr. Chair, Madam Chair, I may have in support of what the Esmihan is saying, nakikiusap kami dahil habang hindi buo yung universal health care, lalo na yung PhilHealth, hindi pa nag-i-increase yung kanilang mga case rates. Ito po yung pangtakip. More open than not, kailangan talaga ito. Hindi lang sa mga members of the House na napupuntahan ng mga pasyente, kundi pati na rin mga senador. I mean, we have to consider na hindi pa perfect yung ating healthcare. Hindi pa libre talaga. Wala pang insurance sa mga tao natin. So, we'd like to request the Senate panel to kindly consider kasi this is good for everyone. And walang funding dito na dumadaan sa kamay ng politician. Diretso ito from the DOH regional office. Diretso binabayad ito sa mga hospitals when the bills are forwarded to them. So, Mr. Chair, Madam Chair, I'd like to request to have this approved. Thank you.
Madam Chair.
Mr. Chair.
Madam Chair.
First, Minority Leader Marcelino Lebanan, then Representative Marco Zamora.
Madam Chair. Maraming salamat, Madam Chair.
Then Congressman J.J. Romualdo, Representative Brian Yamsuan. Those four. Thank you.
Kami po ay in behalf of For Peace Party List, nakikiusap po kami na i-reconsider po itong MAIP natin na 49 billion dahil napakalaking tulong po ito sa ating mga taong bayan, lalo na yung mga mahihirap. Ito po yung inaasahan ng napakarami po sa atin At sa amin pong experience ay na-mention na ni Deputy Speaker Singson yung mga reasons, kaya nakikiusap po kami sa House panel na matulungan ng ating mga kababayan sa pamamaraan ng maipip na pag sila'y nagkakasakit. Maraming salamat po, Madam Chair.
Thank you. Next, Representative Marcos Zamora.
Thank you, Madam Chair. I just would like to share one best practice that we observe in the province, where RHUs that are already categorized as primary healthcare facilities are already qualified RHUs to receive MAIP. And once these RHUs were being downloaded with MAIP, it actually helps local government unit earn from MAIP. So parang kung ano yung kulang ng RHU in terms of personnel, doon nila nakukuha sa income nila sa MAIP. So it's actually not limited to hospitals alone, but it actually supports the rural health units. So parang ito yung nagiging tulong din ng national government for RHUs, LGUs to earn and provide whatever the LGU can complement. So I'm with the group in appealing from the Senate our Senate counterpart to retain this proposed budget for MAIP. Ang laki po talaga ng tulong, hindi lang sa pasyente, pati na sa local government units na kulang ng panggastos sa RHUs.
Thank you. Next, Representative JJ Romualdo.
Thank you, Madam Chair. Your Honors, good evening. This representation would like to appeal to the honorable members of the BICAM, especially on the Senate, considering that we are staying in an island province, Your Honors. It's really hard, bringing all the patients to the mainland, especially on the serious special cases. MAIF really is the catalyst or makatulong talaga pagdating doon, lalo na pag serious cases na hindi magampanan namin sa ospital. All our requests, our appeals are very valid, but on our part, being staying in island provinces, just like any other island provinces, bringing into the mainland to the regional hospitals or private hospitals, ang hirap po kung mababawasan po yung MAIF. So therefore, we appeal, Your Honors, for our MAIFs.
Thank you, Representative Brian Suwan. Brian Yam Suwan.
Thank you po, at I'm in support of all of my colleagues in the House of Representatives to ask for your help to approve this MAIP program because it's talagang essential ho sa malaking tulong ho, and sa akin lang one good experience sa amin yung ating mga nakatira sa mission area, especially sa amin sa 2nd District ng Parañaque. Napakiusapan ko yung 3 ospital na malalaki doon, yung Parañaque Doctors, yung Medical Center Parañaque and UniHealth, na pumapayag na sila na gamitin yung MAIP namin para yung mga kababayan natin hindi lang nakasentro dun sa mga district hospitals. So nabibigyan ho namin sila ng sapat na medical attention na hindi na sila kinakabahan na puro district hospital lang pinupuntahan. So yun ho yung use ng ating MAIP sa atin, at ako I'm in support of my colleagues, so I hope that our senators will also consider, kasi nagagamit naman ho siya para sa ating mga kababayan.
If I may po, I believe this was something that stood out to me during the interpellations in the Senate. This was Senator Risa actually who raised this point. I think we can look at it also in terms of the number of beneficiaries that would be reduced or cut out from the program if we do not restore the amount. In 2025 po, the number of beneficiaries given the GAA amount of 41.2 billion pesos was 3.3 million beneficiaries. And with the cut if the House version is not adopted, that would reduce the number of beneficiaries by 1.1 million. So, ganun po katindi yung potential impact that you would have, bababa po yung bilang ng mga pasyente na masaserbisyohan natin mula 3.2 million ng 2025 pababa ng 1.1 million lang ng 2026. And as we know, tumataas pa rin naman po yung bilang ng mga kaso na mga pasyente na kailangan po nating i-cater. And again, in 2025, wala pa po yung pangangailangan para sa full implementation ng zero balance billing. So hence, with that, I appeal to our colleagues in the Senate to please consider adopting the House version of MyFIP, which is at 49.2 49,203. But if you add the Senate, if you add the requirements of the Senate, that would come to around 51 billion pesos.
Kong Mika, just to pick on your point earlier, how many beneficiaries you said for 2025?
Given the current levels of MyFIP in the 2025 General Appropriations Act, which is 41.2 billion pesos. The number of beneficiaries serviced in 2025, actually, hindi pa po nagtatapos yung taon, so this can actually be a little bit higher. It's 3.3 million patients.
And then if in the Senate version, the one we approved, how many patients is that equivalent?
In the Senate version, if we don't adopt the additional 20,
Because you said the 2025 is how much already?
41.2.
41.
Yes. So
Ngayon
with
kasi Senate is 29.
29. So yung
28. Yeah.
So with the 28, that would be
kukunti yung pasyente.
yes po, 1.1 million patients po yung mawawalan.
Di mawawalan.
Opo.
So from 3 million magiging
2.1 million na lang po.
2.1 million ang hindi bibigyan ng MAIP.
Opo. Ganun po kadami. And as we all know, ang natutulungan po talaga ng MyFIP ay yung pinaka-indigent natin ng mga kababayan. So I think it's important to contextualize it in that, looking at it in that viewpoint, which is that's 1.1 million of the most indigent patients losing access to MyFIP.
Yes, Senator Lauren.
Mr. Chair, I see the point of the House because under the universal health care, and if PhilHealth is able to increase its case rates and to be more efficient, in a perfect world, as we were discussing earlier, dapat pagpasok ng mahirap sa isang pampublikong ospital, makikater na ang kanyang pangangailangan. Dapat ganun. Hindi kailangan yung kilala yung mayor, congressman, senador. Sana ganun. At dapat ganun. At kausap ko po yung Health Coalition, sila Dr. Dance, kausap yung Senator Pia, Senator Risa, and Dr. Lichon. Ganun sana ang mungkahin nila, na ang PhilHealth lahat. That is in a perfect world. Hindi pa po naaabot yung perfect world. In the meantime, paano po ang mga congressman po, frontliners, ang mga mayors, frontliners, naging congressman po tayo, representante, most of us here. Nakita po natin yung pangangailangan ng mga tao at ang MyFIP, dati MyFIP lang tawag dyan ay hindi lang yung DOH, retained district, sa pagkaintindi ko pati sa mga polyclinic, LG, para mangyari na yung adikain natin sa universal health care. Until such time that the UHC law is really completely, properly implemented and PhilHealth is able to handle all of this, I believe that we must provide for the poorest of the poor in the most far-flung islands and the highest uplands and in many GIDA areas. So I respectfully recommend. I know in a BICAM we should uphold the Senate version, but I see the importance, the urgency of the requests of our colleagues. So I think it's very more than reasonable. Pero wag natin sanayin na ayon sa patronage. At dapat naman, hindi yung mga may kaya, kasi may nagsabi na ayon sa PSA o sa ibang mga reports, may kaya o mayayaman daw. Hindi naman. Oo, kasi sa karanasan ko rin, hanggang ngayon, maski hindi na ako representante, pero yun, lumalapit doon. Pero it's really up to DOH how to implement this. But I see the point that DOH retained hospitals and up to polyclinics and what you call the small hospitals, the district hospitals ba yun? Oo. RHUs, yes, RHUs, which don't have funding on their own, can use the MAIP. That's my view, Mr. Chair. Thank you.
Thank you very much, Lauren. Just to add po, ang kagandahan po na MAIFIP, kasi hindi lang siya government hospitals. May ganong flexibility po kasi ang dami po na magtatanong ka bakit pumupunta sa private hospital kahit po indigent. It just so happens that there are certain treatments, halimbawa po radiation or neuro cases na wala po sa mga accessible government hospitals, nandun lang sa mga private hospitals, or in case of, for example, motorcycle accidents, you rush the patient to the nearest hospital. So yun po siguro yung kagandahan ng MAIFIP. Binibigyan po tayo ng flexibility na tumugon talaga kung saan po kailangan nung ating indigent na kababayan ng tulong natin.
Thank you for bringing it up, Chair. Dapat damihan ng DOH ang kanilang MOA sa private hospitals. At saka ganito ang sitwasyon kung government hospitals lang, punong-puno, sino nagsabi kanina, 300% mag-aantay ng ilang buwan, paano pag emergency? Pangalawa, papasok ko sa pampublikong ospital, wala naman sapat na gamit o kulang ng tao. How do you address the needs of the poorest of the poor? So, dapat may MOA sa lahat ng mga pribadong ospital sa lugar na yun. And I'll repeat, this is not going to be the norm because the UHC should really be implemented and PhilHealth should actually fund all of this. But for the next year's budget, habang hindi pa sapat ang ino-offer ng PhilHealth or hindi pa kompleto yung universal healthcare, I think it is our responsibility, Mr. Chair, if you see fit, to fund the MAIFIP. Thank you.
Thank you, Senator Lauren. We recognize Senator Erwin first, I think.
Just on the point.
Okay.
Yes,
Yeah, go ahead.
It was I who mentioned that because of the zero balance billing announcement, there are many government hospitals. In fact, I was in a conversation with Dr. Gap Legaspi of PGH. They're experiencing 300% occupancy. And therefore, the challenge is how do you, because precisely of zero balance billing. So, and therefore, this may be one way of addressing the increase in occupancy in our public hospitals.
I concur, Senator Kiko. In fact, I was looking at the data. On the average here in Metro Manila, the occupancy rate is about 200% to 300%, but in some cases 300%. Kasi libre sa government hospitals. Ang nagiging issue lang, you have to wait 4 months before you can get a surgery. So, ang choice mo, pupunta ka ng private hospital. Pero mahal ang private hospital. Dito naman papasok yung MAIFIP or PhilHealth. But PhilHealth cannot pay for all. No, mababa rin yung kanyang case rate, may limit rin siya. No, so dito talaga pumapasok yung itong MAIP.
Mr. Chair, I would just like to add, totoo po yung mga sinasabi ng mga kasama natin. Yung PhilHealth po, may mga hospitals sa provinces, they don't accept PhilHealth kasi may mga utang pa ang PhilHealth. Pangalawa, yung meron din po yung tinatawag na AIX na ginagamit para sa hospital. May mga hospital na hindi po tumatanggap ng AIX. Ang pinakakilala lang po ng mga hospitals, halos lahat ng hospitals ay MAIFIP. Even St. Luke's, Cardinal Santos, mga malalaking private hospitals, they do accept MAIFIP now. Why? Kasi alam po nila na madaling mapuno yung mga government hospitals. Pag emergency, ang ginagawa po ng mga kababayan natin, bahala na. tsaka na lang kami hihingi ng tulong. Alam nila walang pambayad. Kaya lalapit sila sa mga politiko para humingi ng pambayad. Ito po yung yung mga guarantee letters na binibigay naman para through yung MAIF ng MAIFIP ng Department of Health. So, ito po yung MAIFIP ang pinaka-widely accepted ng halos lahat ng ospital sa city, sa provinces, far-flung areas. Ito po yung naintindihan. Kasi yung PhilHealth, may mga ospital po hindi tumatanggap ng PhilHealth ID card. Kahit na po yung ICE ng DSWD, minsan may mga hospital na hindi po kilala yan. Ang kilala lang po ng karamihan ng hospitals, I think 90 to 95% of the hospitals ay yung sa DOH na MAIFIP, Mr. Chair.
Sir Kiko?
If I may just go back to the point also raised earlier by Senator Legarda. Ang malaking batikos dito sa ganitong sistema ay yung patronage na ginagamit ng mga politiko as an opportunity para matulungan yung mga sumusuporta sa kanila. But I think what we need to perhaps to prevent that is to have some safeguards by way of maybe a special provision as to how it should be implemented, number one. Number two, so that's one point, no? How to address this issue of being patronage politics being perpetuated. So let's put in place safeguards to prevent that, so that the system in place will insulate, no, the program from politicking, number one. Number two, maybe the concern also is that dahil sa NEP, 24 billion ang President's budget. Pero dinagdagan natin ng more than double. Halos more than double. It should have been 48, but it's 49. Of course, the fiscal space is a challenge. But ang Senate version naman, if you will look at the screen, we allocated 1 billion for DOH Universal Health Care Fund for zero balance billing in local government unit hospitals. So perhaps maybe that is one way kasi nabanggit ng chairman ng House panel na this is also to address the zero balance billing. So maybe a portion of the 49 billion we can put dun sa LGU hospitals for zero balance billing, which we've already we've already put 1 billion. Baka pwedeng dagdagan din yun, no? O yung 49, may portion of that dagdagan dun sa LGU hospitals for the zero balance billing to be implemented in the LGU hospitals. So I'm trying to find a happy compromise in this regard, Mr. Chairman.
Thank you, Senator Kiko. In fact, the different agencies have issued several circulars na bawal na talagang i-politicize yung mga tulong sa tao. For example, yung mga AIX, TUPAD, MAIP, but even scholarship. So meron na silang directive or circular. And on top of that, meron rin tayong special provision na bawal rin i-politicize. No? So that is another safeguard na hindi mapapoliticize itong mga tulong sa tao. No? Yung importante lang naman dito ay matulungan ng tao. No? That's the most important. Yes, Senator Amy?
Yes, maraming salamat Mr. Chair and Madam Chair. Wala naman sigurong tututol sa pangangailangan ng MAIP. Talagang kailangan yun. Ang problema lang, sa totoo lang, naaasiwa ako pag hinihingan ako ng GL, ng mahiwagang guarantee letter. Hindi karapat-dapat na ang Pilipino ay naninikluhod sa iba't ibang politiko para lamang magamot. Ang tingin ko, kung bibigyan yung iba't ibang mga ospital, hindi ba maaari na physician's priority na ang gawin? Huwag na tayo nakikialam doon, kundi yung mga doktor ang magsasabi kung sino talaga. Pero talagang awang-awa talaga ako sa ating mga kababayan na talagang pumipila pa sa atin at nagmamakaawa. Hindi po dapat yun.
Madam Chair.
Yes, Representative Javi Benitez.
So I agree that we should also move from a patronage-based type of system to an institutional-based system. No, I think that's what we have done in implementing the free college, for example. I think yung gusto ng kababayan natin ay sana sa health naman. Lagayin po natin sa health ang ating maging ideal world, sinasabi po ni Sen. Lauren, na pagpunta sa isang ospital, hindi na kailangan ang makaawa sa isang politiko or mag-isip na kailangan pang bayaran ito. And when I spoke to ang DOH at that time, they were saying that the number is actually 70 billion. Naglabas po sila ng zero balance billing, that is option 3, which is a claims-based na simple, is 70 billion what's needed. And the reason why there is patronage or pagpili is because it's limited resources. No? So if we give it a number na maka-free ang lahat, then they will never need to go to a politician because their needs are already met. And that number is 70 billion. So I'd just like to say that I want to support the increase of the MyFib. If the House version, of course, with this bicameral committee is approved, but sana in the future, maging totoong zero balance billing, and from our universal healthcare that was law in 2019, ma-fully realized soon. Yun lang po. Thank you.
Madam Chair.
Yes, Representative Maricor Zamora.
Yes, because there was a mention earlier about the proposal of Senate for the DOH Universal Healthcare Fund for zero balance billing in local government. May I just know, Madam Chair, Mr. Chair, what would be the mechanism of this proposed program? And what is the difference between this program and the MAIFIB?
This is a pilot program. In fact, I just got a text from Senator Pia. She's coming over. Because ang DOH hospital zero balance na. Ang LGU gusto mag-zero balance. Pero hirap sila, I'm sure alam ni Abet to. Most LGUs, si Maricor, you were a governor before. I was a mayor before. Talagang kinakain ng budget. As Governor Alvarez, no? Kinakain talaga ng hospital bills or hospital operation in budget ng LGU. So we allocated 1 billion to help the LGUs achieve zero balance billing. This is just ang idea dito, this is just a trial fund because wala pa talaga ang DOH mechanism to download this. But we want them to already help the LGUs in achieving zero balance billing. So, ano ito, parang trial lang, no? Kasi wala pa silang guidelines on this.
Okay. Madam Chair.
In fact, we introduced a special provision na dapat mag-coordinate in DOH LGUs para to create that guideline.
Madam Chair, Mr. Chair.
Go ahead, Kong Maricor.
Because based on how MAIF is being implemented now, there are already LGU hospitals that are already availing MAIF, and they're actually implementing zero balance billing dahil nada-download si MAIF directly to the LGU, utilizing the MAIF sa provincial hospital. So, hindi ba po siya magiging duplication itong item na to sa MAIFIP where it's already implemented now na pwede nang direkta sa LGU?
Ang conversation namin dito, itong DOH Universal Healthcare for Zero Balance Billing in Local Government Units, para siyang subsidy. No, para siyang subsidy for your hospital. So for example, sa Bataan may hospital kayo, pwede niyang i-subsidize. Kami sa Valenzuela, pwede niyang i-subsidize. Or sa Ilocos Norte, pwede niyang diretso i-subsidize. So that's the mechanism there. No? Yeah. So yan yung idea. But they have to come up with guidelines to operation.
Yeah, Mr. Chair.
Well,
Kaya po nag-worry. Yes.
Yun ang yung pangkalakan.
Ayon po ako doon.
Kailangan,
ayokong lumuluhod yung ating mga kababayan
but
para lang
but admittedly, wala kasing wala pa kasing guidelines to, no? So that's why we included in the special provision to consult with the LGUs.
Yes, Mr. Chair. Kasi yung MyPIF, it's already in the LGU hospitals and it's implementable already. Kaya yung another one na hindi kami sure kasi gagawa pa ng guidelines. While the MyPIF, we know na kaya nang magamit kaagad ng patients. So, doon kami nag-worry na tatanggalin niyo yung MyPIF, dadalhin sa something na hindi pa klaro. Well, we know na mabilis magamit yung MyPIF.
Importante ngayon, mabilis matulungan ng tao. Diba? Kasi any delay, ang sakit hindi mo madidelay eh. No? Ang opera hindi mo madidelay. No? So we need to have a mechanism na mabilis ang tulong sa tao. Alright. So,
Mr. Chair? Hindi, ako masalita ng konti pa. Oh.
go ahead po.
Hindi, ayaw ko lang din marinig kay Senator Aimee with her indulgence na pumipila sa politiko. 4 na taon na po ako, wala pa akong pasyente na pupunta sa akin. Meron lang akong team of social services sa bawat munisipyo, sila nag-aasikaso. Even without mentioning na nagaling sa congressman, in fact, yung mga ibang distrito, doon pa pumupunta sa akin. So, walang pili. Ganon din eh. So, dahil sa awa natin doon sa mga walang-wala. In the meantime lang naman ito, na wala pa yung universal healthcare, yung zero balance billing. In the meantime that all of these are not in place, payagan na muna natin ito. Yan lang ang pakiusap. But kung nandyan na lahat yan, wala nang pumipila sa politiko. Dahil hindi ko sila nakikita eh. I just established in every municipality my team of social workers ako na gumagawa ng rekomendasyon. Yan po, Madam.
Yes, Mr. Chair. Pasensya, Manong Pipito. Pasensya, pero talaga haba-haba po ng pila dyan sa Senado. Kaawa-awa talaga. Kaya ang sinasabi ko, kung maaari, wala nang guarantee letter, basta ibagsak na sa mga kinakailangan o nangangailangan ng mga ospital at yung doktor ang magsasabi kung sino talaga ang pinaka-priority medically, hindi politically po. Salamat, yun lang po.
Mr. Chair. Madam Chair, to add to what's being discussed regarding yung pumipila at yung patronage, yung ibang districts, and I'm sure sa Valenzuela, very efficient, at nabanggit naman ni Kong Alvarez, gumagawa na ho ng one-stop shop para hindi na po kailangan pumila. And in the case of Bataan, nandun po yung PCSO, PhilHealth, nandun yung DSWD, nandun yung social worker, nandun yung MyFIP, para isa na lang ho yung pupuntahan na under one roof. Hindi na ho kailangan makita yung mga public servants in that locality. Diretso na po sila. So these are some innovations being done by our district representatives and our local government units para ma-ensure na nababawasan or halos wala nang pumipila yung dignidad nung kawawang pasyente, lalo na kung mahirap, ay na-maintain at hindi nababawasan dahil one-stop shop parang professionally being managed by our social workers. Madam Chair, I just wanted to add that in the discussion. Maraming salamat po.
Minute suspension. So let's resume. So may we restate the motion again?
Mr. Chair, I move to retain the amount, sorry, my apologies po. I move to adopt as the final amount for MAIFIP 51,648,816,000.
Any motion?
Second.
Julie seconded. The budget is the motion of the chairperson Swan Singh is hereby adopted.
Thank you very much to our colleagues in the Senate. Maraming salamat po.
Mr. Chair.
Senators.
Thank you, Your Honors.
Mr. Chair, just with the understanding that the safeguards by way of special provisions on ensuring that it's insulated from politics and is put in place. Thank you, Mr. President.
Senator Lacson introduced special provision. Actually, it's a general provision kasi cuts all across all the different services of government na bawal ang politiko. And in fairness to the agencies, meron na rin silang mga directive, all of them. No? So that's already in place. But of course, we need to be vigilant and also active to implement that.
Mr. Chair, if I may add, hindi naman po kasi itong MAIFIP, hindi po kagaya ito ng AX at saka tupad na binibigay mo cash, di ba? This is like just a referral letter na binibigay ng sa tao na bibit-bitin sa ospital or yung ospital already informed kasi may mga politicians na sabihin, pumunta ka na lang sa ospital doon. Tsaka doon na nababayaran. Wala siyang nahawakan na cash like AX, I like tupad, yung kinakatakot natin. So that's a fact. So hindi talaga mahawakan ng politiko yun. None. Because hindi naman cash po ang MAIP eh. Baka akala po ng mga kababayan natin watching us, MAIP is not cash po. So it is a guarantee letter. It's the DOH that pays or that foot the bill of the individual person. So walang binibigay na cash ang politiko, Mr. Chair.
Thank you, Senator Erwin, for mentioning that, because not everybody who is probably watching now has ever witnessed a bicameral conference committee. And when they see numbers by the hundreds of millions, if not billions, they might think that the additional 20 billion, which the Senate is agreeing with the House, will be money that will be lodged in congressmen's offices or in senators' offices. Ang MAIFIP, yes, gumagano si Governor Alvarez. Siyempre, kaya nga pinapaliwanag ko po, para lang po, we're on the same team. Okay, anyway, I'm just trying to explain. This is diretso sa mga polyclinic, district hospitals, rural health units, na minsan nga kulang nga ng equipment. Ang ideal, sana wala nang guarantee letter. In fact, pag sapat, ang tanong ko rin, pag sapat na ang binibigay ng MAIFIP, ng DOH ang MAIFIP, hindi naman kailangan ng guarantee letter mula sa senador na minention ni Senator Marcos o sa inyo. Pagpasok nila, pag sapat ang pondo ng rural health unit or polyclinic, umiikot na yon sa pondo nila libre, hindi kailangan mag-antay ng pirma ng congressman o ng staff ng congressman, di ba? Basta sapat ang pondo. Siguro sa linigay natin ngayon, in short, hindi pumipili ang politiko ng kanyang may sakit. Hindi pumipili dapat ang politiko pag may sakit yung leader ng kalaban niya, walang GL. Hindi po dapat ganon. That's what the chair means. Let us not politicize it. Yeah. Walang nameless, faceless, no political color. Tama ba ho? Ang intindi ko na pag nandun na sa rural health unit, whatever health facility, letter or not, pagpasok doon, dapat i-entertain. So yun yung zero balance billing. The MAIFIP should complement and supplement what the President himself has said on the ZBB. Tama? Okay. Thank you. So
Madam
that
Chair.
is clear. Thank you.
Yes, Representative Alvarez.
Mr. Chair, with your respects, gusto ko lang maipropose na karamihan kasing doktor sa private hospitals alam nila na JL ang ibabayad ng regional office ng DOH, nagtitake advantage. Imbis na 50,000, dinodoble nila yung kanilang professional fee. Kitang-kita eh. So, more often than not, sa lahat ng may mga hospital na mga lugar sa distrito ko, mini-meeting ko sa kanila na huwag sila mag-overprice. Kung tama lang, kasi ito sana, na-approve na natin yung MAEPEP, kung maaari sana yung professional fee ng mga doktor. Isama na po natin dahil kasama pero 50% lang. Kung sana maaari magawa na natin 100% yung professional fee para talagang hindi na maantala yung paglabas. Kung minsan naghihintay pa yung pasyente sa akin, nagtitik sa akin sa Manila. Professional fees now, they accept 50%. So I suggest, Madam Chair, Mr. Chair, na kung maaari, gawin na natin 100%. With the provision na kausapin natin ang mga doktor na huwag mag-overcharge. Ginagawa ko po yun sa lugar ko, especially in Brooks Point, 3 private hospital doon. Miniting ko sila, nakiusap ako dahil nagbayad na ng nagdala na ng JL galing sa social service office ko. Siyempre, ayaw pang palabasin. Dito ko sa Manila, nagtitext, tatawag pa ako sa Puerto Princesa para mag-deliver ng pera doon sa isang bayan. That's 3 hours away from Puerto. Mahirap po na lalong-lalo na magaling na yung bata, nandoon ang nanay, wala nang makain doon dahil uuwi pa sa kanila. Pati nga pamasahe noon, marami po kayo may mga indigents sa Southern Palawan, especially mga indigenous people. Kaya hindi naman, wala akong indigenous people nakita na nagluluko doon sa MAIPEP at saka sa mga pribilehiyo eh. So, more often than not, talagang naantala yung kanilang pag-uwi. Lalo na kung masama ang weather. Hindi bali kung 1 oras lang yung biyahe na magandang weather, simentado yung kwarsada. Aakyat pa sa bundok yan. Kaya kung maaari, propose ko na yun na bayaran na natin 100% ang provisional fee, tanggapin na natin na 100% mababayad. Thank you, Madam Chair, Mr. Chair.
Senator Amy?
Yes, thank you very much, Mr. Chairman and Madam Chair. I'd just like to bring our attention to the general provision referred to earlier by Chairman Gatchalian. It's an IB 683 page between lines 52 and 53. And this refers to the prohibition on political involvement in cash distribution. So, nakikita ko naman na talaga naman maganda ang mithiin nito. Subalit, sa kabila niyan, kinakailangan basahin natin ng maigi. Unang-una, wag natin limitahan sa cash. Kasi yung MAIP nga tulad ng pinaliwanag ni Senator Erwin, talagang hindi naman cash. Pero dapat sakop pa rin ito. Pero medyo mabigat rin ang wording kasi walang politikong present to participate in, to influence, or otherwise take part. Medyo mabigat kasi alam naman natin ang trabaho natin, taga-endorse, taga-recommend, lahat ng request natin sa tambak, siguro naman hindi mamasamain. Kaya gusto ko sana na i-review sana itong general provision. Palawakin siya kasi maganda ang mithiin na hindi lang cash assistance kundi lahat ng assistance. Tapos wag naman sakop lahat na halos may penalty pa. Kapag ando ng politiko, parang mabigat-bigat naman yata to. Higit sa lahat, I do believe that legally this is actually surplusage when in fact we already have the DAP ruling, which is very clear that politicians should not meddle in any way in the implementation of projects. Once the budget is passed, it's hands off to all legislators. Yun lang po, mere observation and perhaps an invitation to review this general provision.
Mr. Chair,
Senator?
may I also manifest to a provision? Kasi po, the professional's fee is not included. And hindi po tumatanggap ang mga doktor, karamihan sa kanila ng MAIP. So if we can put a special provision na i-incorporate na ng hospital dun sa bill ng pasyente yung professional fee. Kasi usually po dapat isama na po ng ospital. Bahala na muna yung ospital magbayad sa doktor because ito po ang problem. Bayad po yung bill, hindi pa rin po makalabas ang pasyente because hindi pa bayad yung professional fee. So tumatakbo na naman, nadadagdagan yung per araw, everyday na he overstays in the hospital. Kaya nga ko, if we can make a special provision, Mr. Chair, na isama na doon sa hospital bill ang professional fee para pagbayad ng MAIP, makalabas na yung tao. Kasi the problem right now, Mr. Chair, bayad nga yung hospital bill. Sasabihin naman ng hospital yung professional fee. So hindi pa rin makalabas po yung pasyente. So siguro isang provision, Mr. Chair, na incorporate natin dito, na isama na ng hospital, ang hospital na ang maglagay ng professional fee sa total bill para yung hospital na muna magbabayad sa doktor, Mr. Chair.
Two notes po, if I may, Senwin. First po, with regard to the manifestation of Senator Amy Marcos, we would like for the record state that the House contingent supports the manifestation of Senator Amy Marcos to review the wording as currently proposed by the Senate with regard to the general provision prohibiting the the political involvement in these activities. I totally agree 100% with the manifestation of Senator Amy that this actually impinges on like a previous ruling already made by the Supreme Court pertaining to DAP. So I agree, it's the penal provision, it's a penal clause that's actually a little bit, that's the reason why the House is a little bit hesitant with regard to adopting it. With regard to the manifestation of Senator Erwin Tulfo, we actually do have in the HGAB a proposal pertaining to the professional fees. So in the HGAB, as you would see po, the special provision says that 100% of the professional fees should be inclusible in the MAIFIP disbursement. So we thank Senator Amy Marcos and Senator Erwin Tulfo because those are both positions of the House, very much consistent with the positions of the House contingent. Thank you very much, Pa.
Thank you. And I also concur that the suggestions of Senator Amy will definitely study that and tighten it. Senator Pia also suggested language on the inclusion of professional fees, subject to the formulation of guidelines to govern the coverage of professional fees. So, kasi nga ang tricky dyan, Gov, yung presyo ng professional fee. No? Kasi mayroong mahal na professional fee, mas mura, depending saan siya nag-graduate, depending saan siya nag-practice. So we'll leave that to the DOH. Pero insofar as MAIF can be used, it can be used.
Mr. Chair, point of clarification, the professional fee, yung charges is depending on the room that you get. Kung ba VIP din yung charge sa'yo. Kung yung mga like semi-private din yung i-charge sa'yo. Yan po yung kalakaran sa mga hospitals these days, Mr. Chair.
Salamat. So we can...
Mr. Chair?
Yes.
Again, another point of clarification for Chairwoman. If you could indicate to us, alin sa HGAB, anong bahagi doon na may professional fees at magkano ang nakalaan?
In the HGAB po, we have a special provision under MAIFIP, which says the amount appropriated herein under medical assistance to indigent and financially incapacitated patients shall be used for hospitalization and medical assistance to indigent or financially incapacitated patients, including but not limited to inpatient services, outpatient services, comprehensive checkups, emergency services, dental services, ambulatory care services, ophthalmology services, drugs, and medicines as approved by the FDA. And 100% professional fees, subject to the guidelines issued by the DOH. In no case shall more than 1% of said amount be used for administrative expenses. So in the version po of the HCAP, it clearly states, it expressly states that 100% of the professional fees should be covered by MAIFIP.
All right, so I think we can move on to The next item.
Madam
Before
Chair.
we proceed, just on the earlier manifestation of the chairperson of the House panel, perhaps we can include another phrase after 100% fees, professional fees. Well, I'm thinking of the language, but that the fees should be commensurate or should be commensurate to the indigent patient's ability to pay or something to that effect. But precisely, it's for indigents. And then you're going to charge, you will overprice your fees because ang alam ng doktor, gobyerno magbabayad. It defeats the whole purpose of us providing precisely the medical care that an indigent is entitled to. So maybe we can, Mr. Chairman, we can probably include an additional phrase to qualify, to put a qualification on the fees precisely that the doctors can charge, given that this is a program that's meant for indigents.
Thank you, Senator Kiko. That is actually something that we've discussed earlier when we did our huddle. That maybe a qualifier that we can put is that only those in the charity ward would be guaranteed the 100% coverage of professional fees under MyFIP. Pwede po yun para ma-insulate din naman po yung mga, baka naman po sobra yung charge as mentioned earlier, baka sa VIP room or sa private room. So maybe that's something we can explore. Putting in a caveat saying that it only covers, that the 100% professional fee coverage for MyFIP only pertains to those in charity wards.
Thank you, Senator Kiko, for those interventions. So we move on to the next item.
And with the House contingent, or just asking, would that be commensurate to adopting the House version of the special provision pertaining to professional fees?
We actually modified it. We allowed the DOH to come up with guidelines. Instead of nakasulat 100%, let the DOH study it. Kasi like I said, ang professional fees, ang layo ng spectrum eh. No? So sila nila mag-evaluate. Yeah.
Mr. Chair, I just want to raise a point. In 2025, it's already that provision that
Provision number 6.
it's a provision number 6, wherein it says that medical assistance to indigent and financially incapacitated patients, the amount appropriated herein under MAIP shall be used for hospitalization and medical assistance to indigent or financially incapacitated patients, including but not limited to inpatient service, outpatient service, comprehensive checkup, emergency service, dental service, drug, medicine as approved by the FDA, and professional fees, Mr. Chair, subject to the guidelines issued by the DOH. In no case shall more than 2% of the said amount be used for administrative expenses. So we already have this, Mr. Chair, Madam Chair, since last year.
However po, if I may respond po, what we want to modify in that version of the provision in the 2025 GAA is that we want to stipulate that it has to be 100% of the professional fees. And second, we're actually arguing against the 2% administrative cost being that's stipulated in the 2025 GAA. Kasi po, AICS, Tupad, and even other more, labor-intensive programs only charge 1%. So very interesting po that the DOH is asking for a 2% administrative cost. So yun po yung dalawang binabago po natin sa special provision as stated in the 2025 GAA.
Mr. Chair, may I?
Madam Chair.
May I clarify whether DOLE really just charges 1% and DSWD 1% for TUPAD and AICS respectively? Is that clarified? LBRMO, 1%. So dapat,
Iba-iba siya.
iba-iba?
Iba siya.
No, Chair Swansing said that it's only 1% with DOLE and 1% for DSWD. The admin cost, I think there should be
Alam ko social pension.
I think there should be a standard, no? Not depending on the agency, not by whim.
Thank you, Sen. Lauren. Actually, exactly that's what we did exactly in the HGAP version. So we aligned everything because we found out that in AX it can vary so it can go up to 5% actually in some areas. So yun yung parang hindi po siya standard. That's why we said we can standardize it kasi may
It should not be depending on the areas. The admin fee will differ for DSWD. Oh, I'm not sure of that.
Para ano po, like for example, social pension for sure is 1%. So that's something that I'm sure of. We heard there are instances po, especially if it's an ATM disbursement, it can command up to 5% of the administrative cost. So yun po, kaya yun po isa naming tinitignan na dapat ma-standardize din natin yan.
Because of this, I think, Mr. Chair, we should stipulate in the GAA the admin fee of the agency. Otherwise, it will be their discretion. That's dangerous. And it's difficult for the COA to audit as well if it's 1% or 5%, depende sa probinsya, kung isla ba, bundok, hindi. Mahirap yun. Oo. So, I think we should stipulate and we should agree on the percentage of the admin fee.
That's what we included in the HGAP version, Senator Lawrence. So we put their administrative costs for the different, not just MyFIP, we put it for the others also. So we did try to do that, which is to standardize the administrative cost for the different programs in the HGAP version po.
Yeah, Mr.
Thank
Chair,
you.
one last hearing.
Yes, Senator Amy, go ahead.
So sorry. Hindi, yung nabanggit lang kasi na lilimitahan sa 100% payment ng professional fee para lamang sa charity ward. Parang sa palagay ko, nakikita naman natin ang ating mga ospital, umaabot ng 300% occupancy ang charity ward. Kaya napipilitan ang ating mga kababayan pumunta sa pay ward. Kaya hindi rin makakatulong kung pipilitin natin na limited ang professional fee sa mga charity ward lamang. Kaya siguro maganda na rin yung sinabi ni Chairman Gatchalian na hayaan na muna gumawa ng IRR. Halimbawa, ang DOH, total napakalaki ng halaga ng 49 billion. Dapat managot naman sila sa atin, may oversight of some sort.
All right, so we will take note of that, Senator Amy. Yeah. Yes, go ahead.
Mr. Chair, Madam Chair, if I may. Dito po sa House version ng MyFIP na may 100% professional fee. After that, subject to the guidelines issued by the DOH. So, baka yun na po yung sinasabi ni Sen. Amy na dun sa 100% para tunay na mapakinabangan ng ating mga kababayan, based on that, gagawa ng guidelines yung ating DOH. Kasi as it stands now, 50% lang po ang naija-charge. Kaya yung pasyente po natin, kahit nabayaran na ng MyFIP yung hospital bill and 50% nung professional fee, hindi pa rin makalabas ng ospital at dun po lalapit sa mga politiko. Buti na lang si Governor Pepito Alvarez, maraming pwedeng pang out of pocket. Pero dun sa iba na hindi na kayang mag-abono, at least magkaroon na po ng relief yung indigent patient na tuluyan ng once magaling, covered na ng MyFIP, tuloy-tuloy na po makalabas ng ospital. So anyway, the proposal ng House ay gagawa po ng guidelines ang DOH. Thank you po, Mr. Chair, Madam Chair.
Good evening. Just a quick
Let
response.
me recognize you first. Let me recognize the presence of Senator Pia Cayetano.
I feel I've been present because I was monitoring in the 1 hour that I was in traffic. Anyway, on that note, let me just give a quick comment. Congressman Abet, good evening. I think it's been said, so I won't take up everyone's time. That the concern is there are overpriced. Now I think all of us can understand it happens in some places. So if we just say guidelines without saying 50% or 100%, and we will express to DOH this forms part of the record that we're not objecting to 100%. It can be anywhere between the current 50 and in the 2026 budget, it could go up to 100%. But they have to provide the proper guidelines. So if I don't know, if it's in a private hospital and they know that 100% is way above the average price for such a procedure, I think they can provide limits. So that's my recommendation so that we give DOH that leeway. Thank you.
All right. Thank you. So we'll take note of the comments of our esteemed senators.
Senmin, if we may move to the next item. I believe this is also a disagreeing provision pertaining to the Health Facilities Enhancement Program, or the HFEP. Similarly, we appeal to our colleagues in the Senate contingent to please consider restoring the increase effected by the House pertaining to HFEP to have a final amount of 26.26 billion pesos. That includes the 5.69 billion peso increase effected by the House from NEP to HGAP.
With the chair.
Yes, Representative Rufus
Yeah,
Rodriguez.
just like to support the plea of our chairperson, because our rural health units, which are usually the beneficiaries of this HFEP, are our first line of defense on diseases and medical attention. And if we do not have sufficient funds for health facilities enhancement program, expansion of rural health units, expansion, the purchase of equipment, and also to have medical care available to our people, then we will fail in making sure that at the frontline level, we are enhancing the ability of our health units to respond to health needs. So I would support our chair in appealing that we retain the 20 or increase it to 26 billion pesos. Thank you, Mr. Chairman.
Thank you, Representative Rodriguez. I would like to further clarify that the proposed increase of 5.69 billion pesos includes the completion of legacy hospitals. Those are NKTI, Philippine Cancer Center, PCMC, Mariano Marcos Memorial Hospital and Medical Center, West Visayas State University Medical Center, Northwestern Cagayan General Hospital, Bataan General Hospital and Medical Center, Bicol Regional Hospital and Medical Center, Mayor Hilarion A. Ramiro Senior Medical Center, Northeastern Misamis General Hospital, and Orani District Hospital. In Bataan, there's also the Senator... So ano po to? It's a lot of different HFEP facilities subsumed under the proposed 5.69 billion increase.
Right, so How many facilities will be built with those amounts? And who will build it?
Mr. Chair, Madam Chair, tungkol doon sa
Senator Will,
question
while
of
I retrieve the data, I'll first like to recognize Representative Pepito Alvarez.
how many facilities. Kanya-kanya po yung submit ng hospital facilities improvement program. Yung Northern Palawan po, meron silang 8 hospital doon. Tinamaan ng bagyo. Kaya sa latest inventaryo namin, nangangailangan sila ng mga 300 million. But total Palawan, including those na mga sira-sira ng hospital, kailangan namin at least 500. Minimum yun for next year. Para ma-upkeep yung mga hospital na yun, there are 16 LGU-owned hospitals all over Palawan. And there are 2 DOH-owned hospitals. The one in Colyon, which is the Colyon General Hospital, and the one in Puerto Princesa, which is the hospital ng Palawan. Before that was owned by the LGU, it was reverted back to the DOH. So all in all, we have 18 hospitals there na government and LGU owned. Yun po. So sa kalahatan, nangangailangan kami for next year. Minimum po yung talagang nasagad na. Maski na bagyo yung sa norte, we only need about 500. But every year, yung maintenance meron yan. So the next 2027, 2028 might not be that amount. Kaya yung 26 billion na yan, Palawan pa lang yun. We are the largest province in the whole country. And ganun po karami yung hospital namin doon because of the distance. And remember, Palawan is a tourism region. For every peso that we invest in Palawan, we give back to national GDP 2 to 3 pesos back. Ganun po ang ratio. So, tulungan naman natin yung HPEP na yan, adapt na lang natin yung Senate version na 26, which is very reasonable considering ang daming tinamaan din ng bagyo the last 3 months. Thank you.
Mr. Chair, I will just, I want to say like tama po yung sinasabi po ni Congressman Alvarez from Palawan. As a matter of fact, hindi na tayo lalayo, Congressman Kong Alvarez. Yung hospital ng Palawan pala sa city, kailangan na mag-expand, kailangan na tumaas kasi punong-puno na po ng tao at hindi na magkasya. Kaya ang end result, yung mga tao pupunta lang sa Adventist, pupunta sa Co-op, tapos lumalapit sa mga politiko para humingi ng MAIP para mabayaran the Co-op Hospital, Mr. Chair, and Adventist Hospital ay private hospitals. Kasi hindi na nga ma-accommodate ng hospital ng Palawan, yung provincial hospital, dahil kulang talaga ng mga kama, Mr. Chair.
Mr. Chair.
Yes, Senator Kiko.
Yes, I think one of the concerns on the funding for these facilities would be the findings of a investigation in the House about ghost facilities or substandard facilities or incomplete facilities. So my question here is how do we prevent a repeat of the poor or unacceptable implementation of ang public works ba ulit ang gagawa nitong mga proyektong ito? Kasi kung ganun, baka lang hindi kaya kumuha na lang tayo ng bato, pukpok natin sa ulo natin dahil baka masakit na naman ang ulo sasakit lang ulit ang ulo natin kung hindi maayos yung magiging implementasyon.
If I may respond to the query of Senator Kiko. So, ginawa po namin, in the HCAF version, you would see a special provision pertaining to HFEP wherein we adopted a similar provision as in the basic BEF. Nahilo lang. Basic Education Facilities Program, or BEF, wherein we've opened up the modes by which these facilities can be built. So, ginaya po namin kasi po, di ba, aside from DOH and DPWH, we're also opening it to LGUs and PPPs. So, similar po to the adjustment that we did for the BEF, we also stipulated the same as a special provision. And then to respond po to the query relating to how many health facilities are subsumed under the proposed 5.7 billion, it would be a total of 62 health facilities all over the country.
Yes, Mr. Chairman, just to follow through on that, and I recall now when we were hearing the classroom acceleration program. It was mentioned earlier, but I just like to stress that point that when you have the private sector PPP program in place, and you have local matching between the local government and or getting the local government to be a partner in the infrastructure. At one point, the DepEd was able to build 600 classrooms a week. This was under President Aquino's time. And Brother Armin, who was the Secretary of Education then, would attest that they were able to fill up the backlog. And so we welcome this special provision wherein you have PPP, you have local government engagement to be able to address the infrastructure facilities for the health budget, for the Department of Health budget. Thank you. Thank you.
Thank you very much, Senator Kiko. Actually po, that also doesn't preclude the need to talk to Secretary Ted Herbosa, because as we all know, the reason for the huge delay in the implementation of HFEP and the very low utilization rate for HFEP, not only in 2025 but in previous years, is the very delayed release of their guidelines. Meron din pong problema administratively within the DOH relating to how they're implementing this program. So aside from opening up the modes, we're also doubling down on ensuring that that DOH releases the HFEP guidelines in a timely manner. Kasi may iba po nagsasabi, March pa lang nag-release ng guidelines for HFEP, tapos may delay pa further in terms of the bidding and everything. So halos hindi na po siya talaga nasisimulan before the end of the year. So we intend to do that as well po.
Senator Pia?
Just an addition to the discussion, it was Secretary Herbosa who said that they have a lot of ghost projects. So when we were reviewing the amounts for HFEP, and we really wanted to increase it, we always want to increase it every year. DOH could not give us any figures. As we held our plenary debates up to that day from the hearing, plenary debate, they could not tell us exactly the status for every HFEP. They could not tell us how many were abandoned, how many were finished but not operational, how many were finished but had insufficient equipment, how many had equipment but no health personnel. They did not have it. So when I think of our colleagues in the House and mayors individually, I can get their individual commitment that they will, of course, operationalize it. But when you look at it on a totality, ang daming billions of funds worth that are not being able to use for healthcare. The delivery of healthcare has failed in that sense. So it is our collective decision to decide how to proceed. Yun lang naman, I really always support the increase, but we have no answer as of this moment on the status of these facilities. And one last point I'd like to make on the healthcare resources, human healthcare resources. The budget for our Doktor para sa Bayan and allied health is something that I've always fought for. And this goes into our ability to have human bodies, professional human bodies in every health center in your districts. in our country. We're far from achieving it, but our goal is getting closer. But according to the Secretary, and by all means spread into the record if you feel otherwise, a lot of LGUs will sign a MOA to commit that they will hire health professionals, and then hindi sila makahire. Whether that is a budgetary constraint on the part of the LGU, or there is just no health professional willing to serve in that area, I do not know the individual reasons. I can give you the top 5 general reasons that are received, but that is the end result. Wala silang nakahire. So there's a nationwide problem which we're trying to address by funding the human health resource gap, but individually we have to look to our colleagues in the House to help us address this situation so that maybe next year we can have a better situation. Thank you, Mr. Chairman.
Madam Chair, Mr. Chair.
Yes, Representative Pepito Alvarez.
Yeah, in
then,
response to
and then Representative Albert Garcia.
Thank you. In response to the good senator, ma'am, maraming salamat. I can only speak of the whole Palawan. We have 12 non-performing large-scale RHU. Out of 12, isa pa lang ang may license. When I'm talking about the HPEP that we need in Palawan, hindi kasama po yung mga large-scale RHU na yan na hindi funded, na hindi pa umaandar. I'm talking about 16 hospitals built by the LGU together with HPEP program before when I was governor. And then we have dalawang DOH hospital. Yan po ang sitwasyon doon. At yung LGU hospitals, yung manning, doctor, nurses, midwives, and medtechs are all scholars of the provincial government. Meron kaming fund, 50 million a year. And nagagraduate namin ng doctor between 12 to 15 every year. Mga midwives namin, meron po kaming at least minimum 6 to 10. And then mga medtech, meron ding 6 to 10 na nagagraduate. So, yung mga hospital namin, kompleto po sa staffing. Hindi kami nagkukulang. In fact, yung mga doktor sa barrios na pinapadala ng DOH doon, tuwan-tuwa sila dahil marami silang katuwang. So, ganun po nangyayari. I can only speak of Palawan. I don't know of the other regions and the other provinces. So, itong HPEP na hinihingi namin particularly for Palawan, I'm very parochial, but hindi po. In general, I'm talking about the whole country. Kailangan talaga natin suportahan yon HPEP. Kasi wala yung HPEP na yan, hindi kami makabuild doon ng 16 hospitals na good size. Others are 100 beds, others are 50 beds. But that will ensure the confidence of our tourist arrivals. Kasi every 100 kilometers, nakikita nila yung hospital nandoon at saka naasikaso talaga sila. Except for one in Coron, which was a little bit neglected kasi meron tayong general hospital sa Colyon, which is the Colyon General Hospital. More often than not, doon sila pumupunta dahil kompleto doon. So ganun po yung sitwasyon. And when we requested funds sa DOH, nakita nila na reasonably yung request. So if all of the requests are being made in the spirit that we have to put these facilities to work, dapat wag natin deny yung pera na kailangan doon sa hospital improvement program na yun. Maraming salamat, Mr. Chair, Madam Chair.
Mr. Chairman, dagdag ko lang. At meron na rin po kayong Palawan Medical Center. So, isama nyo na yun dun sa pagbibisita ng mga turista para makita nila yung medical school sa Palawan. We're very proud of that. So, thank you rin sa support ninyo dyan.
Ngayon na lang nagawa yung dahil sa suporta ninyo dito. Pero nung araw, hindi nagawa yung medical school doon. In spite of the fact na yung HUC doon, nagkaroon ng 300 million pondo galing sa akin noon, ay hindi nila nagawa yung medical school dahil sa corruption. Maraming salamat, Mr. Chair, Madam Chair.
Thank you. And I agree with this special provision. It's time to unleash the local government units, di ba, Kong Abet? Dahil maraming kagaybatan na very active, very aggressive, kailangan ma-empower rin sila eh. So if DOH can partner with the local government units, mag-counterparting sila, local government na magpagawa, mas mabilis eh. Kasi ngayon, exclusive ang DPWH to build HFEP facilities, kaya hindi natatapos. But now, with this special provision and everyone can build at the same time parang school building, then I think mas bibilis yung implementation ng HFEP. No?
If I may lang po, Senator Win, before I yield the floor to Representative Abet, I just wanted to comment on the point of Senator Pia. I totally agree po, especially with the issue around super health centers that are non-functioning. It's really because a lot of the LGUs do not actually adhere to the MOAs that they sign, that they will ensure that they provide doctors and operating funds. So yun po siguro yung pwede nating tignan, that DOH has to be more strict in terms of implementing and enforcing the MOA. So ano po, pwede po natin kausapin yung DOH tungkol doon. Representative Abet Garcia, please.
Yes, thank you, Madam Chair, Mr. Chair. Just to add to what Madam Chair said, regarding the DOH HFEP facilities, medyo exaggerated po yung nabanggit sa news na ghost. It is really more yung mga non-functional, like what the chair said, na nagawa yung super RHU, tapos nasa MOA with the LGU, nalalagyan ng mga staff, pero siguro kulang din ang pondo yung LGU, hindi nalagyan, so hindi nag-function. So this also came about during the budget deliberation of DOH, and Secretary Ted Herbosa, doing a catch-up plan on this, said that he would be more diligent in implementing the MOA with the LGU para talagang mabawasan or totally mawala na yung mga non-functioning LGU. Kasi sayang naman kung mapipinalize yung mga proactive LGU like yung kila Congressman Alvarez sa Palawan dahil dun sa kakulangan o dun sa kakulangan sa pagiging proactive ng mga ibang LGU. So sana maging merit-based dun sa mga talagang nakikipagtulungan with the national government, in this particular case DOH, sana mabigyan din natin ng chance para mas maraming makinabang ng mga kababayan natin. Thank you, Mr. Chair, Madam Chair, and Senator Pia. Salamat po.
Mr. Chair, may kausap ka na rin lang, sisingit na ako. Very quickly lang, not for our colleagues, kasi I agree 100% with what Congressman Abit said, but for the listening public, the viewing public, when we checked during the hearing, wala naman talagang lumabas na ghost HFEP. Walang ghost, yung binayaran, tapos hindi na itayo. Yung katulad ng sinabi ko and emphasized by His Honor, Congressman Garcia, yung mga non-functioning for the reasons I mentioned. So for the public to know, kasi baka mamaya ma-headline dyan, sinabi ko may ghost. Pareho tayo ng observations, yung mga non-functioning for various reasons. Thank you.
Senator Amy.
Mr. Chair, allow me to be the devil's advocate in the optimism that we all share, that broadening the modes of construction of RHUs, of public schools, and so on, will be hastened and expedited by bringing in LGUs, NGOs, CSOs, etc. Totoo nga, nakakatulong yan. Pero nakita naman natin ang karanasan ng late great nating Bayani Fernando, hirap na hirap siya. At ang katotohanan, ang talagang nangangailangan ng mga LGU, ang sila rin ang walang kakayahan. Yan ang problema. The ones most needy are also the least capable in terms of finances, technical, and so on. Kaya may hangganan rin itong pagpapartner. Kaya medyo minsan hindi ako masyadong gangho dyan dahil alam naman natin yung mga 4th and 5th class and 6th class municipalities kung meron pa, talagang hindi nila kayang gawin. Kaya sila, ang pinakamalalayo, sila pa talagang hindi makapagbayad. Wala talagang kakayahan. Kaya yun ang tanong ko kung puros partnership ang inaasahan natin, baka yung mayayaman, masigasig ang mga LCE, yung magagaling ang kanilang mga doktor at engineer, kakayanin yon, pero hindi lahat. Ikalawa, magtatanong lang ako sa ating chairwoman ng appropriations kung tama ba yung narinig ko na kalakip nitong HREP sa meron rin tayong mga hospital na legacy hospital na andito yung mga kidney center at iba pa. Tinatanong ko lang for accounting purposes and perhaps in the interest of tidiness, would it not be better to directly release them to the large hospitals who are in any case government enterprises and in fact chartered corporations? Hindi ba dapat diretso? Bakit ilalagay pa sa DOH? Tatagal din lang yan.
Thank you, Senator Amy. I'll just quickly check in. Kasi po, when we submitted this as an amendment, actually po, it was the advice also of DOH to clump it in under HFEP. But I'll just quickly check po, I agree also with the recommendation of Senator Amy that perhaps rather than lodge it there under HFEP, the 2.4 billion pesos that we've allocated towards the completion of legacy hospitals can be lodged directly in each of the different hospitals. That's something that will be open to to considering. We'll just quickly check po again with DOH as to why they recommended to put the funds under HFEP.
Yes, they haven't had an exactly stellar performance, and as a result, it's perhaps faster and cheaper to simply endow the hospitals concerned. Thank you very much, Madam Chair.
Thank you very much, Senator Amy. We'll look into this and we'll get back to you po as soon as we're able because there's a possibility of moving it out from HFEP and lodging it towards the different hospitals.
All right. Can you restate the motion?
Yes. With what was shared, wherein we ensure that the implementation of HFEP will hopefully be a lot better in 2026, given the special provision increasing the modes by which these health facilities can be implemented. Meaning, aside from DOH, DPWH, you can also enlist the help of LGUs and PPPs. With that, we again appeal to our colleagues in the Senate to please consider adopting the version of the HGAB pertaining to the increase in the Health Facilities Enhancement Program to the amount of 22,294,967,000.
All right. Any second? Julie seconded the motion of Chairperson Mika Swansing is hereby adopted. Thank you.
Again, thank you very much to our colleagues in the Senate, and we assure that we will work with you in making sure DOH performs better in implementing the Health Facilities Enhancement Program. Maraming salamat po.
Thank you for that. We'll move on to the Department of Budgetary Support to Government Corporations, Department of Health, and yes, Senator Amy.
Sorry, Mr. Chair, sorry to interrupt, but there is an unmentioned and unlisted item which occurs actually in the budget. We are proceeding to the Department of Health, government corporations, the various hospitals. But before letter F, there's an E4, which is the PhilHealth Insurance Corporation, which we're fully aware of. Originally, in the NEP, only 53 billion was the endowment to PhilHealth. And naturally, given the Supreme Court decision, which was, by the way, unanimous, a very rare occurrence, 60 billion was added. Given that there's a specific bill rendering such transfers illegal, and also quoting that fund balance, the term fund balance, while ambiguous, is also very, very important. There's also an indication on the part of the Supreme Court that the specific benefits and packages to be expanded should have been indicated. So I would like to say that we have increased this, therefore, in compliance to the ruling, to 113,261,000,000 and so on. And we are right to do so. However, the reality is we should perhaps be reminded that this is no straightforward allocation. But in fact, it's in the nature of a refund of an illegal transfer. I don't think it's perhaps the topic or the agenda of this BICAM, but would it be possible to obtain a breakdown of exactly where this 60 billion went? Kasi kung tutuusin, pag susuma sa accounting po, ito na ang ikalawang release or ikalawang pagbibigay ng GAA sa PhilHealth. So, ang mahirap dito, para kang nag-double release. Kasi nagbigay na tayo noon, pagkatapos magbibigay ngayon, pero walang refund as such. I'm fully aware that the Constitution requires that there should be a GAA allocation for any release of any government entity. However, it should be kept in view that this is like a second release na. So anong ginamit? Anong pinaggamitan ng 60 billion? Pwede ba magtanong nun? At ang problema nito, parang ikalawang release na to. Pagbabawalan yan kapag accounting firm yan. Isa yon. Ikalawa, there are far-reaching effects for other GOCCs and GFIs. Naiisip ko lang na halimbawa yung fund balance na sinasabi excess funds ng Land Bank at ng DBP were transferred to the Maharlika Fund, jeopardizing and violating perhaps both banks' minimum capital requirements. Kasi napilitan magbigay ulit ng pera dun sa dalawang bangko at baka manganib sila at sa kakulangan. They had to be topped up. So, kapag susundan natin itong Supreme Court Precedent, baka humiyaw lahat ng government corporations na yung pinagkukuha sa kanila na sinasabing profit nila o excess funds or fund balance, dapat isoli sa kanila sa kada GAA. Yun lang po, naisip ko lang at mahirap na.
Thank you very much, Senator Amy. To answer the query, I will defer to Senior Vice Chairperson Albert Garcia, who defended the budget of the DOH.
Thank you, Madam Chair. Very good points raised by Senator Amy, particularly
Okay, we
kung
stop for a
saan
while, guys.
nagastos
Tapos balik
yung
tayo.
60 billion. I'm sure gusto rin
Okay.
malaman ng ating mga kababayan.
Balik tayo.
So during the budget deliberation and defense of the DOH,